Good day! In this video, I will be discussing about atopic dermatitis. Atopic dermatitis is the most common type of hypersensitivity that resulted from the increased production of the immunoglobulin E antibody class. Immunoglobulin E is produced by the immune system. Immunoglobulin E travels to the cells that release chemicals causing allergic reaction. Diagnostic procedures are skin testing or scratch testing. It is done through placing a tiny bit of an allergen such as pollen or food on the skin, then prick the outer layer of the skin or make a small scratch on the skin. Next is CBC. Third is RAS test. RAS test is also known as radioallergosorbent test. It is a way of testing a person's blood to see if they have any allergies. This test checks their blood for specific immunoglobulin E antibodies to find out what substances they may be allergic to. The risk factors are personal or family history of eczema, allergies, hay fever, and asthma. So let's talk about the pathophysiology. It starts with a gene variation that affects the skin's ability to provide protection. So there's impaired epidermal barrier, innate immune system defect, which the defect in cell-mediated epidermal barrier repair process could result to the inflammation and leaky junctions between cells. Adaptive immune response system defect that causes overexpression of type 2 helper cytokines and immunoglobulin E in response to antigens. And fourth is the altered skin microbiome. So these four could result to these. Increased transepidermal water loss. Exacerbation of this could by long hot showers, sweating, stress could result to cirrhosis. Cirrhosis is a medical name for dry skin. Cirro means dry and osis means disease. Next is disruption of stratum corneum allows penetration of irritants, microbes, and antigens, followed by exacerbations by irritants and allergens like detergents, solvents, hard water, clothing, environmental aeroallergens, could result to stimulation of cutaneous itch receptors, causing pruritus and skin infection. This pruritus could result to excoriation. Excoriation is the repeated picking at one's own skin, which result in skin lesions. Excoriation can result to acute inflammation of dermatitis, resulting to erythema, and chronic hyperplasia of subcorneal epidermis, or the second layer, to result to lesions and plaques. Third is the immune dysregulation. Acute keratinocyte release of cytokines mediators increase type 2 helper T cells and immunoglobulin E, resulting to the immune dysregulation to chronic disease punctuated by acute flares with low resolution, leading to hyperplasia of keratinocytes within stratum corneum, leading to or causing hyperkeratosis or scale. This would also result to intracellular edema within epidermal layer, intraepidermal vesicles, causing spongiosis. And this immune dysregulation can also cause increased immunoglobulin E. From spongiosis, there are it could be vesicles and papules. Vesicles are small, clear, fluid-filled blisters that is less than 10 mm in diameter, and papule is elevated, solid, palpable lesion that is less than equal 1 cm in diameter. Disruption, then this vesicle could disrupt from crutching, causing oozing, dry scale, and crusting. The signs and symptoms are dry skin, itching, red to brownish gray patches, small raised bumps, thick and cracked scaly skin, and raw, sensitive, swollen skin from scratching. Medical management are corticosteroid, antibiotic, dupilumab. Treatment modalities are is to moisturize the skin at least twice a day, avoid the trigger, take shower bath or shower, and the use of gentle soap. Nursing diagnoses are impaired integrity related to contact with irritants or allergens as evidenced by itching and swollen skin. Distorted body image related to visible skin lesions, and risk for infection related to impaired skin integrity. Lastly, we have the nursing interventions. These are the following. Encourage patient to bathe in warm water using mild soap. Administer oral antibiotics or topical antibiotics as indicated. Identify signs of itching and scratching. Prepare the patient for phototherapy or photochemotherapy. And lastly, allow patient to verbalize feelings regarding the skin condition. So that's all for atopic dermatitis. Thank you for watching.